Hello, I'm Harvey Godwin Jr., Chairman of the Lumbee Tribe. I'm here today as a follow-up from, right after Christmas with Dr. Chamaine Brooks Locklear, and I wanted to bring her back in here to the administration building here at the Lumbee Tribe Culture Center, just to do a follow-up since our last conversation when we were really focusing on testing, and also where we are now as far as vaccinations and what you feel is the numbers are looking like and where we need to be to come out of this COVID situation as far as mass gathering and mask or no mask.
Mm-hmm.
So I'm glad you're here today. Thank you for coming.
Thanks for having me.
You're welcome.
Right now, in our state and in our county, we have what we call low positivity rates. It's less than 5%, which is really good. So we're in a good place right now. Even in Robinson County locally, our numbers have been really good for about 12 weeks. So we've kept our cases down really well. There's been a slight uptick the past 2 weeks. This past week was 164 cases. So we'll see the trend there. The thing to note that's different though is that statewide in North Carolina, there's 49 or 50% of the adult community that's been vaccinated. However, in Robinson County, that number is close to about 20% that's been vaccinated. Now for Robinson County, the 65 and older population is 57% vaccinated, so they're doing better, but we have a long ways to go to catch up to the state average of people vaccinated. One thing that's definitely different now than many months ago is we do have much better treatment for COVID. So one piece of advice is if you're sick, you want to go get a test, because if you are positive, you want to let your doctor or other healthcare provider know if you're positive to see if you qualify for a particular treatment. There's different what we call monoclonal antibody infusions. And these infusions, if given early in the illness, can make a huge difference in the outcomes. So if you get an infusion early on, within especially the first week of your illness, we can prevent pneumonia and admissions and of course death. If you let your doctor know a week and a half later after your symptoms have started, it's actually too late to do the infusions. That's very important. Many people are high risk, of course 65 and older, but then even if you're under 65, if you have any chronic condition, it could be just obesity. So obesity, hypertension, diabetes, asthma, any one of those type of chronic diseases will qualify you to get an infusion. So that's good news that people need to be aware of. So you don't want to hide it, you want to let your doctor know that you're positive, and if you got tested at urgent care, so that way if you're my patient, I can just put the order in and get your infusion right away. That's very, very important. But I really wanted to touch base on just vaccines, since now the vaccines have been available to the population. Anyone 60 and older, every adult in North Carolina is eligible. We know there's 2 types of vaccines that were first approved. They're the mRNA vaccines. That's the Moderna and Pfizer. And then the third that's been approved is the Johnson & Johnson. So I wanted to talk a little about it. We definitely know these mRNA vaccines are very, very effective. In fact, they're 95% effective. And it's been proven in many studies after they were approved back in December that even amongst healthcare workers like myself who were exposed to COVID, if we're vaccinated, we're highly protected to prevent COVID. So that's excellent news, not just in trials, but in real life people, of millions of healthcare workers, it's effective. That's good. They're proven to be very safe. So there's a very low chance of any kind of serious allergic reaction. Very low. You're much more likely to have a serious allergic reaction to a prescription pill you get from your doctor's office, a prescription for an antibiotic, a pain medicine. Those things are way more likely to cause a reaction than the vaccine. That's how rare it is. The other thing is you should expect to have some sort of symptoms, specifically after your second injection. The rule of thumb is over 50% of people will have either fever, chills, fatigue, or headache. So one of those, what we call systemic symptoms, is just the side effect that the vaccine is working. It's boosting your immune system. You are making antibodies. That's a good sign, actually. We tend to think if you're staying hydrated with water, it helps. And of course, if you have those symptoms, you can take something like Motrin, Advil, or Aleve, and that can reduce those symptoms. You don't have to suffer for the day. But usually those symptoms can last 24 or up to 48 hours. If you're having symptoms greater than 48 hours, it's likely not a vaccine reaction. And we know these symptoms are not a reason to avoid the vaccine. It's something that we should expect and counsel the public on, that you should just expect something like that may happen, but that means that it's working. That's not a reason to not get the vaccine. It means it's a good vaccine. It's an effective vaccine. There's also questions about this new technology. So even though for the public it's their first time hearing what an mRNA is, we should be reassured that to scientists, they're well versed in mRNA technology. That technology has been going on for over 30 years now. So some scientists have spent decades studying mRNA technology for such a time as this. It's brilliant, safe technology. It's easy and effective. Likely future vaccines will be made with this technology. But it's not necessarily new to scientists, it's just new to the public. When they're making the mRNA vaccines, they do not use any type of cell line, so that means they do not use any fetal aborted cells to make mRNA vaccines. Apparently there's been some sort of myths or confusion out there about that even patients ask me about still today, but there's no type of cells ever used with mRNA. It's super brilliant, clean technology in a lab. They don't even use a cell, it's so easy. The only one contraindication to not getting those mRNA vaccines is if you know you have an allergic reaction to something called polyethylene glycol, which is the main ingredient of Miralax. If you know you're allergic to Miralax, you shouldn't get the vaccine. The only second indication to not getting it is if you had a severe allergic reaction to the first shot, you should not get the second shot. So that is very few Americans. That's a few per million. That's very rare that you shouldn't get the vaccine. There is no other reason to not get an mRNA vaccine. That's how safe it is. So even if you have allergic reaction to the flu shot, the pneumonia shot, any other vaccine, it has really no bearing on your ability to safely get an mRNA vaccine because it's completely different technology. It's so different, okay? The other thing is there's been proven studies that show this mRNA technology does not cause any infertility. In fact, many women have become pregnant in between their vaccines, and it's been proven safe during pregnancy. So a few studies have been proven it's not only safe in pregnancy, but once you deliver your child, your infant has immune system, like they have antibodies that's going to be protective against COVID. So that's actually a good thing that you're blessing your child with, is protection for COVID. And these are just a lot of the questions I get about mRNA. So those again are the Moderna and Pfizer. Super safe, very effective, 2-part series. We really need more and more of our patients to get these vaccines. They're easily available through many locations in the county. And then I wanted to speak about the third vaccine that's available. That's that Johnson & Johnson, which is completely different technology. It's a more common, what we call adenovirus technology. So it's not mRNA, and it's a single shot. You probably heard a couple weeks ago how the CDC put a halt on it. At the time, they had 6 cases of a rare condition that they found. It's called thrombosis with thrombocytopenia syndrome. TTS is what we call it. And so they put a pause because they were trying to be safe, and they wanted to assess the situation. And after assessing the situation for a couple of weeks, they determined that after millions of people getting the vaccine, a total of 15 people had this rare reaction, okay? So 15 people out of millions. In fact, the total was 1.9 person per 1 million vaccines given. And all people who have this condition are women between the ages of 18 and 49. So it's a subset of women. This is what they call the immune-mediated response. It's rare, but it could happen. The experts looked at all the information and came to the conclusion last week to resume giving the Johnson & Johnson because they felt like the benefits of the vaccine far outweighed the risk of the vaccine. So there was 2 numbers I wrote down to make sure I shared with you, and that's out of 1 million vaccines given, this is specifically Johnson & Johnson, out of 1 million vaccines given, it will save 2,100 deaths, so that's 2,100 less deaths, and it will save 6,000 hospitalizations versus those 15 people, which is 1.9 per million that got this very, very rare condition. So even though 1.9 out of a million would get this condition, you're saving thousands of lives, thousands and thousands of admissions. So of course they said, well, the odds are in your favor. The experts also say If you know you have a personal history of immune-mediated thrombosis or thrombocytopenia in the past, you should be the person that should avoid the Johnson & Johnson and proceed with the Moderna or Pfizer. If you don't have that condition, then you can safely get the Johnson & Johnson. It's literally 1.9 per 1 million vaccines given. So the odds are definitely in your favor, especially in a pandemic with a super contagious vaccine that we know has already killed 560,000 Americans. So if you have questions about that, that is something you should really ask with your doctor and make sure you know where you're getting your medical advice from. But they did resume that. So now a lot of the pharmacies in the area are continuing to give out the Johnson & Johnson. Certain same-day drive-thrus or clinics, especially certain high-risk populations, the vulnerable or homeless. There are certain people it's a lot easier to give the single shot Johnson & Johnson versus having to get the dual shot. So it's perfect for a lot of people, especially males. So if you're even just a female that's concerned, discuss it with your doctor, but it's a very rare condition. So I wanted to clarify that today.
So you said earlier that 57% of the people over 65 have had the vaccination.
Yeah, in Robinson County.
In Robinson County. And it's like, it's
77% the state.
For the state.
So we're lacking, like our overall adult population that's vaccinated is less than the state, be it for age groups, but just in general, Native Americans are very low.
Yeah. So this information from the Robinson Health Department says that age group of 25 to 49, that is 12%. And for American Indians, its vaccination rate is 13%. So we have a lot of work to do amongst Lumbee people and in that age group of 25 to 49. And what, when we first started these conversations a long time ago, a year, I guess 13 months ago, the main thing we wanted to do as a tribe was to protect our elders. And I just talked to an elder today that I attend church with, and she lost her husband about 4 months ago. And she was telling me about when she gets the loneliness, that they're retired, they run around and do things during the day, but at night, he was outside person, worked in his grapevines and stuff like that. But they were always in the house at night and had dinner together, and that's when they had their time. And that's when she's the loneliness. And I've heard so many other stories like that where we've lost elders from COVID over the last 13 months. And the tribe, we're going to do something in the near future to acknowledge love tribal members or anyone probably, we haven't planned it all out yet, who have lost, to honor the families that have lost a loved one, not just from COVID, but from any illness or for any reason over the last year. But we really need to focus down. I say all that to say this, that age group, the young people, to protect the elders, they gotta get vaccinated.
Yeah, we know that the elder population are the ones that succumb to more complications. So they're way more likely to be admitted, and of course, they're more likely to die. But we as the younger population, if we do our part, we're protecting ourselves, our household, but we're protecting anybody we come into contact with, and that's often our parents and grandparents. And it could be co-workers, it could be just people in the public, but I got a vaccine to protect me, to protect my household family, to protect my extended family, to protect my co-workers, to protect all the patients I see in a day, which is of all ages, newborn to 96-year-olds. Because I know if I get sick, I can spread it to someone else. But if I get vaccinated, I'm keeping myself safe, and anybody I come into contact with, I'm preventing them from getting sick. I'm tangibly loving someone and caring for them by me getting a vaccine. And so getting vaccinated doesn't mean that I think I'm going to die from COVID. It means I don't want to get it. I don't want to live with potential complications of it. But it also means I love those around me, and I don't want this thing to keep spreading and more people to have loss of life, more people to suffer when I know I can completely prevent it. I have a very, very good chance of a safe vaccine that can prevent it. Often I see people who are so shocked that they're positive, and they talk about how they're, quote, being safe, and they're trying to reduce exposures, but it just takes one person. It just takes one person who's shedding that virus to get you sick. It takes 1 minute of contact with one person who's sick to get you sick, and you don't know at the time that person was sick. That's the thing about COVID. And so you can't be too careful. We're not living in a bubble. We're not people that live in a bubble. We're highly social people. If we know we can't live in a bubble, we know we want to socialize, we know we want to return to normalcy, we want to gather with family, we want to go back to church, we want to be in Sunday school. If we want to do those things, the vaccine is the tool we need to do that. We're not going to be able to overcome the pandemic with our actions alone. That's been proven. The vaccine is our only way to get back to normalcy and to reduce these numbers. And what I didn't mention earlier is we are very blessed in the United States to have access to the absolute best vaccines in the world. Many countries have no access to our technology, and that's a whole other debate about vaccine equity. But the facts are the facts. We have the best vaccines, and we're not even utilizing them. We're too spoiled to use what's at our, it's 10 minutes away at a store, at a hospital, at a pharmacy, at the health department. It's minutes away, it's right there, it's free, and we're turning our nose up to it, basically. When other countries are begging and just would do anything to get this vaccine to save lives, you know? And sometimes we gotta think about it in a bigger perspective. It's bigger than us, our household, it's the community, it's our state, it's a world thing. This is a pandemic. And we should all try our best to do our part and not be selfish, but to do what it takes to help protect us and those around us. It's not just me, it's everybody I'm around, you know?
Well, our elders are vaccinating in the nation, in the state, and here in Robertson County, and the stigma around the vaccination, why someone won't take it, the elders are beyond that. And they have, like you say, possibly other health elements that they have to deal with on top of COVID that would exacerbate those conditions. So if the elders are going to take the vaccination, then younger should also, and follow the wisdom of the elders. Because I don't think we've seen a single case where an elder has been vaccinated and it has succumbed from it.
In the hospitals, we can have evidence now looking at the hospitalizations, and there's not vaccinated people in the hospital with COVID. So these vaccines, even though they're 95% effective and 5% of the time you could get the vaccine, it's not a severe illness. We're preventing admissions and death and being on a ventilator, serious illness. So if you were to get positive, it's a mild illness that you just treat at home. It's not a severe illness that I have to worry about all week long.
Well, I want to thank you again for coming by and speaking with us, all of us today, about your expertise in this area, and thank you again for all you're doing. And all our Lumbee medical professionals, all that you do on the front lines during this pandemic. We're not out of it yet, but as you can hear the evidence, please get vaccinated. We need 65% of vaccination rate to get clear of this pandemic, and we are not near that yet. We probably need, I think it's 60,000 more people to get vaccinated to get to that point, based on our population here in Robertson County. So please get vaccinated, and so we can get away from being locked down, from not being able to socialize the way we want to, and get rid of this thing right here. So God bless you. Thank you all for listening today, and may God continue to bless the Lumbee people and all the people of our local area. Thank you.